I hear the tea is we're talking about Bumbums.
BBL.
Yeah.
Brazilian butt lift.
Is that a global health issue? I would just be so mad if I died during a surgery to get a bigger butt.
Yeah, you don't want any random surgeon walking around and get butt.
Yeah, true.
Hello, Globies. Welcome to the World Health Investigation Podcast. My name is Jocelyn.
I'm Edna.
And I'm Loza.
We're three young global health professionals and your hosts for the World Health Investigation Podcast.
Also known as the WHI, we'll be discussing all things global health and unpacking the most controversial health topics,
as well as promoting new wave global health equity and development.
Yes.
So, ladies, what's the tea in global health today?
What's the tea?
What's tea? I hear the tea is we're talking about Bumbums. I hear we're talking about Bumbums today.
We're talking about booty?
We're talking about
BBL. BBL.
Yeah.
Brazilian butt lift.
Is that a global health issue?
That's why we're here to discuss this.
Let's unpack it.
Should it be a global health concern? Well, a lot of women are going through it. We've heard some very traumatic stories, tragic stories have been coming out in the past 5 years, and it's about time we unpack it.
Yeah, I don't think people always consider that, a BBL still like a surgery, an actual clinical thing.
It's a medical procedure.
And it can have a health impact. It's not in and out. Simple.
Yep. And as global people and people that care about everything concerning health, this matters too.
This matters.
BBL lives matter.
Okay.
BBL lives matter.
Okay, so we're going to start with a little case study.
Okay.
It's about a mother of two in the United States of America. In 2016, died at the age of 46. Her name is Lillian Calixto, and she died after a liposuction and butt enhancement surgery which went wrong. Let me find out. After being injected with fat, some of her arteries got clogged and her lungs and heart failed to function.
Ish. That is rough.
Ish.
Medical examiners reported that she had a heart defect, but it turns out that fat particles had actually entered her bloodstream. It was only until recently that this celebrity plastic surgeon in Brazil, who allegedly went by the name Dr. Bumbum.
You're not serious. I'm making this up.
It does sound like a real story, girl.
Look it up, guys. Look it up. Dr. Bumbum actually was charged of murder, y'all. He was charged of murder after a surgery. This surgery didn't go to plan. He did the procedure in his apartment.
That's why things didn't go to plan. What the?
What do you mean?
He did this in his apartment and not his clinic. And prosecutors also charged his mother, his little girlfriend, his secretary, and domestic employee for homicide.
I said everyone went to jail.
Everybody went to jail because they were doing it with him.
Oh.
So his name, for Tado, I don't know if I pronounced it correctly, he was a celebrity with more than 600,000 followers on IG, Instagram, and 44,000 on his Facebook page.
Oh my God.
So in the statement, they said that he helped with others and he had injected this synthetic called polymethyl methacrylate, and it's a synthetic resin which is also known as an acrylic glass filler into the woman's buttocks, and that was more than the recommended quantity, whilst the Brazilian Surgery Society issued warnings about its use and recommended to use in very small doses and with restrictions.
There's a lot to unpack there.
There's a lot going on here.
Wow.
Number one, the fact that he's Dr. Bumbum. I'm sorry, that's a red flag already.
As in, and then in the apartment, surgery in the apartment, were the mother and the girlfriend assistants in there? Like, what?
Like,
yeah, they were assisting him.
Oh my days.
Just playing games with people's lives. Okay. All right.
Yeah. This can't be real.
So it's just one example of many different stories. I'm gonna go into other stories a bit later, but we're gonna unpack it a bit more. So before we unpack this case study, I want to ask you ladies, would you do a BBL?
Hell no.
Unless I already have it. Thank you.
No. Let's relax now.
Why not? Okay, before we, because people, they're valid business to get it. Yeah?
Absolutely.
And everybody has, you know, a freedom of choice and they can decide whether they want to do it or not. Obviously, you have your personal reasons, but why would you, as a personal, as you know yourself, why would you not do it?
Yeah, there's like multiple reasons. And like, again, don't get me wrong, like, I'm not opposed to people getting BBLs. If you want a BBL, you are free to do it.
Go for it.
Go for it, you know. But for me, it's number one, I don't like the idea of putting something synthetic like that into my body. There's that level of it. Number two, it's also hearing stories like this, like of Dr. Bumbum, where people, if you don't go to like a really good surgeon and it's like really well paid, you can end up like having all these complications later on. So there's that fear as well. And then number two, for me, it's just like a level of, you know, God created me. I'm okay with this body. I'm happy with it. I don't want to modify it. Yes, I have insecurities, but you know, I've just learned to accept the body that I have now. So that's more.
Oh, that's awesome.
That's beautiful.
I like that. Mine is gonna be a lot simpler than yours. Mine is I would just be so mad if I died during a surgery to get a bigger butt. That's my sole reason. Like, I'd just be really angry. Like, I didn't need the surgery to begin with. So if I died for a big butt, like, I would be so mad. So it's like, it's not worth it. That's why, like, that's it for me.
Yeah.
I just don't see it as like worth the risk.
True.
Those are very valid points. Well, me personally, I feel like initially I always like, no. When I first heard BBL, why would I do that? That's scary. Never in my life would I consider it. Because I'm young and I'm sorry, my skin is still, you know, very tight and very, very, you know, I'm not.
You're very healthy.
I'm a healthy person. Why would I inject it?
Woman.
At the same time, like, I'm not gonna lie. At one point in life, I really thought, like, after women give birth, right? Some women actually do it after they've given birth, and they want to get back want to get back their old bodies. And you know, you had 3 kids, you have 4 kids, and the stomach is there. Everything is there. You want it to go, so you take some fat from your stomach and you put it in your butt.
It actually is, and it's not even synthetic technically. It's just you're just guiding the fat somewhere else.
Guiding the fat somewhere else. So I mean, that's why I understand why people would want to get it. I think it is risky. So we're going to talk about the risks and the concerns and why it should be whether it should be considered a global health concern or not, and why we should actually care. So I'm going to dive into some background information. So BBL is also known as surgical fat transfer. And studies have actually shown that BBLs have the highest death rates amongst all cosmetic surgeries. And 1 in 3,000 women of color from the US die from this surgical procedure. So to a certain extent, it is a concern, because if many women are going through that and deciding to do it, then there are some things that we need to unpack here.
Yeah.
But in the UK, the surgical fat transfer can usually cost between £2,000 to £8,000, depending on the procedure you're having and the size and where you want it treated. So there are different independent clinics. If you're considering it, please double check. You know, the triple check with a registered place which publishes inspection reports and performance ratings to help people who choose that care. So how does it work? Surgical fat transfer can be carried out under either general anesthetic or local anesthetic. So to break it down, the fat should be injected in the subcutaneous layer, which is the skin, right? And not injected below the muscle. So there are 3 main stages. Number 1, we make small cuts in your skin, and then a thin tube is used to suck out small amounts of fat, which is similar to a liposuction. And the cuts are then closed with stitches.
Okay.
Then you use special equipment, which is used to separate the fat collected from any blood. So any blood or any other fluids. And then these small amounts of fat are injected into the area that is being treated.
Right.
So it sounds easy, right? Simple.
Straightforward.
Could you tell me, like, what could possibly go wrong?
Cut paste.
Yeah.
Not copy paste, Losa.
I meant cut paste.
Cut paste. Sorry.
Yeah.
What are the different things that you, based on from what you're hearing, like, what do you think could possibly go wrong?
The fat does not go where it's supposed to go. That's what I'm feeling. I decides to say, I don't feel like being in the skin.
Yeah. That's the part for me. Also, for me, it's obviously the fat underneath your skin is not always the same, like, size. It's not like perfectly shaped or whatever. So when we start inserting it and stuff like that, like, how much precision is there? Like, okay.
Right, I was thinking that. Is it going to be, like, lumpy? I don't know, man. I'm not a surgeon.
Exactly.
That's the problem. What could go wrong is that if this fat gets injected in the wrong vessel or in large vein, it can cause an embolism. Particularly then if it travels through your heart or your lungs, you die. Just like that, you die.
Fish.
Oh, look at the life of a sick.
So people can die from it really fast in the middle of the procedure. And then I'm going to give you another example. There's another 23-year-old woman from Wales. So you guys think that, oh, these stories only happen abroad, in this UK, we're safe, we don't have to worry about anything. So this woman is from Wales, yeah?
She said UK.
She got her butt done, and although she didn't die, after months of surgery, holes appeared in her backside and was leaking.
Hey, wait. Wait. Jocelyn?
And I was like, pause.
Her butt was leaking.
Her butt was leaking.
That's right.
And she said she couldn't walk properly. It smelled bad, and she had to put a bandage on her butt all at the same time. So check out. We're gonna add this link in the.
Yeah.
Another example.
She got this procedure done like in Wales.
I don't know. She got some of it done in Wales, and then she had to travel to Turkey. I don't know for what reason, but the point is that she's a woman from here. I'm not going to name the entity where she got it from in Wales, but I just know that she's from Wales, and there are even more cases in prestigious surgeons in the US and the UK as well.
Yeah. Anyway.
That's what I've seen. Is the surgery itself is actually high risk. Like even like very qualified surgeons, you can make a mistake.
Yeah. So what would if your daughter was to get something like this, what would you tell her?
My daughter, girl.
If she already got it.
Nah, she wants to get it.
She wants to get it.
I think, girl,
don't do it, girl.
Girl, it's not worth it.
Depending on her age, first and foremost, I think, Jocelyn, like you said, for yourself, like, you're still young and stuff like that. I would also recommend, like, number one, if you're still very young, like, your body hasn't even fully finished developing, you could get your natural BBL. You never know,
the second puberty, it comes at 25 right here.
Exactly.
Yeah.
I'm still waiting.
Yeah, it's coming. Hey, you don't need any more. But yeah, that's a valid thing. I think there's a lot of like girls that get it like at 18, 19, and I'm like, girl, you haven't even given your body a chance.
Exactly.
And the issue is that we've seen so many celebrities.
Yeah.
As I've done my BBL, they'll say, oh, I've done, these flat tummy teeth, all these aesthetic products. So do you now think that beyond this issue, beyond looking at this as, oh, surgical fat transfer is wrong, are there deeper issues that we need to dive into?
Yeah. Do you mean deeper issues as in like in the person themselves?
Yeah.
Within.
And should we now place the responsibility on influencers, public personalities,
right,
on that, having that social, similar to how companies have corporate social responsibility? Should there be a, I don't know, influencer social responsibility?
I like that.
More and more people accountable for the stuff that they advertise.
Yeah,
right.
Yeah, no, I like that, because I think, like, in the early Keeping Up with the Kardashian episodes, there was always this whole thing of like, oh my god, is Kim's butt real? Is it real?
Yeah,
and then she did this whole thing with the X-ray. Like, look, it's all me, it's all real and stuff like that. Now, I don't know what Kim Kardashian has gotten done. This is all alleged. In a case like that, yes, if someone with a BBL were to go and get an X-ray, it will look like just like the fat. You won't be able to see implants there, so it will be like, this is all me and it's my fat and stuff like that. So you can make that claim, but it's again still perhaps unrealistic. It sets an unrealistic expectation for people, especially young people. If you think about celebrities and influencers, they're also people with a lot of money and they can afford to usually get like the better surgeons.
The best, right?
Like Loza, you said the surgery is still very high risk, but it helps to have someone who's like very experienced, and usually you have to pay a bit more coin to get that.
And I don't have the coin.
I don't
think the average person has the coin.
The average person has the coin to maybe go to Turkey and come back. Like
like BBL tourisms.
Yeah, and it makes me think of the influence on social media on young women, and how also as global health citizens and globies, and we need to put that in mind when we're trying to tackle gender equality. We're trying to tackle different issues with the global health space. We've seen that if a lot of women of color are deciding to go through that procedure, that means there's a fundamental issue in the beauty standards that we currently have today. People commenting on women's bodies,
100%.
People having unrealistic expectations, the media having unrealistic expectations on women. Before, it was everybody have a thigh gap, everybody tried to be skinny, everybody
keeps changing that. Yeah.
Like, how long can we keep up for?
Yeah.
Right. And at what cost?
At what cost?
I know, no, that reminds me of like what I read, where with the rise of BBLs, there's also a rise of body dysmorphic disorders. And so a lot of people actually seeking these surgeries are suffering from it. And what I saw was, in Australia at least, the Board of the Cosmetic Surgery is advising doctors not to practice or like not to do BBLs on women before assessing their kind of mental state. And so if they assess and see that they do have like body dysmorphic disorder, maybe provide them with like they care for that instead of directly going to the BBL, because what happens is even after you get the BBL, you're not happy. Like it's kind of mental, and you're just gonna like want more and more and more at the cost of your health. So I'm not sure if they've like passed it yet, but that is like what the recommendation was from what I've read. So
another one. You get
another
your
one,
and then you want your butt, and then you want your boobs, and then you want your then you feel your forehead.
And you see it, like there's TV shows where they kind of like make it like sensationalize it of like these women that are like obsessed with boob jobs, whatever, and it's kind of making fun of the women, but really and truly it's like a mental health issue where what you see is not matching up with what your body actually looks like, and so you want more and more and more. And it's not tackling the real problem.
I've seen like quite a number of YouTube videos. Like, have we seen like a recent rise now of like women who like, I don't know if you guys see them when they're like, okay, my like BBL journey, they'll show themselves before and then they'll say like, now here's my BBL, and a lot of them sometimes they're disappointed. They're like, it's not lifted, it's not what I wanted, and then it's like, okay, now I've already started this journey, do I now go back again, like you guys are saying, need to tweak it a bit more? So you almost start a cycle, or you decide to just stop and your butt looks like what you even want.
That's a very good point, Edna. Now, on that note, do you think that there should be more and more people sharing this, similar to the Me Too movement? There should be more and more people sharing their stories, their BBL stories, good and bad.
Definitely.
Yeah.
Definitely.
I think the honesty is important, and I think we see it a bit more now. Like a couple of years ago, I didn't know BBLs were dangerous like that. I thought, easy fix. But I think I think there's sort of some responsibility of people if they're gonna advertise their body to also share the real experience, so people don't have a false kind of idea of it.
100%. 100%. And then now, aside from sharing your experiences and going around telling different people about what do you think? What about surgical procedures for men? Do you think that men go through similar body dysmorphia issues, and in that case, should there be surgical procedures for men as well, like BBLs for men, if they do?
Allegedly.
Men can get BBLs. There's some men that have got BBLs. Come on now. But no, please, we're trying to make.
Well, I mean, number one, yes, there are cosmetic surgeries for men, and many men get like the cosmetic surgeries, and they do face as well like body dysmorphia. It's probably very silenced in men.
Yeah.
That point. Yeah.
They're like, you're fine.
But yeah, in terms of cosmetic surgeries for men, I think the ones that they get, a lot of them get their jaws done, right?
Oh, yeah.
Some of them like implants like
muscle. Yeah, I've seen the muscles like was it the abs?
The abs.
Oh.
Yeah,
I'm not sure how dangerous.
I mean, steroids. It's not a BBL, but steroids are
right. Like from the pressure of you have to be.
Yeah. So they face a different kind of like ideal body standard. But I think, Jocelyn, to your earlier point, it's not the same as the one that women face. And I actually do have a question for you guys around like, let's say women of color, for example. Do you think there is already that pressure for us to be like very curvy? And then not curvy, and you're seeing some of these like maybe now like white girls, Asian girls who are getting their BBLs, and then you're there thinking like, well, surely I can't hold it.
You're like, where's my?
I'm not feeling my African curves enough.
Exactly.
It's true. Like, I mean, it's a comment that's always made. Like, black women meant to have things going on. If you don't, it's like, what's wrong with you? And I've seen it. Like, I don't know if you also like where people were dragging SZA because all these people in the comments were like, yeah, her butt isn't big enough. Like, what is this? She's all thighs. And I'm like, guys, like, I said, like, what are we meant to do?
And it's like, and it's also like, if you do get your body done, oh, she got her body done.
Yeah, exactly.
If you don't do it, oh, there she goes. She doesn't have boobs. She doesn't have an ass.
Yeah. You can't win. Because let us not forget the fact that, like, for a long time, the big, our black women, the voluptuous bodies were frowned upon.
Absolutely. Not too long ago. You have a big butt, you better hide it.
Exactly. It was seen as a bad thing, but now suddenly it's like trendy.
But bear in mind that once upon a time, we were artifacts.
Tell them.
Okay, yeah.
Once upon a time, the black woman was an artifact in the eyes of colonizers.
Yeah.
For the body.
You know that? I don't know that picture. I don't know what that picture is.
What was her name? Sarah Barton.
Yeah.
Yes.
I believe.
That one. We can check.
Let me fact check myself. Sarah Barton, where she was literally put in a museum because she had a big butt. And they were like, whoa, this is strange.
So it's not like it's a recent problem that people just have the opportunity to change it now. But it makes me think, what do you think about, let's say, women that are not of color, let's say different women, not non-black women, getting their BBL, and then let's say having more and more black features, and then being praised for it.
Or like black features.
Or being praised for it.
Praised for it and being compared to black women. Oh, you have, you're curvy.
Have you seen these that are like, black women, you have nothing going on for you now. I was like, okay. I don't know, man.
But I feel like this has been a thing for a long time, where it's like everyone loves like the non-black women who have like black features.
Black features,
like certain pedestal. I think that has been going on for a long time. And now with the BBLs, everyone is now much more like accepting of the fact that like, yeah, even like white girls can do it. Even we can all, get that body now. So for me, I would say, yeah, fine. Everyone can get your BBL if you want a BBL. But I'm just saying you cannot at the same time be like shaming Black women for the bodies that they naturally have. And I think right now it's sort of like accepted, but my fear is that what about when the BBL stop being trendy? What will happen then? Not only to like the pressure, but also even other people who got the procedure. Like long term, do we really know what's going to happen to your body?
Yeah, it's quite new. Yeah,
that was literally what I was thinking about. We don't know. We don't have enough examples of people at the age of 60, 70 with their butt enhancement surgery.
Yeah.
Or butt lift surgery. So it's a bit risky. And there are many possible complications. I didn't even go through them. The possible complications: bleeding, pain, poor healing, fat necrosis, deep vein thrombosis, cardiac complications, pulmonary complications, accumulation of fluid, and asymmetry of your butt, numbness, scarring, skin loss, and even death.
Even death.
Okay, so it covers everything. Yeah, I mean, it's like, ultimately, it's not that I'm against cosmetic surgeries, I'm not, but it's like, what is pushing people to do it and take the risk is, I think, the root of the problem.
Yeah.
Yeah.
More than that as a problem itself, right?
Yeah.
Right.
There is the issue of like, yes, obviously we would try our best to have medical standards for cosmetic surgeries, like any surgery, you shouldn't be doing in your apartment. But yeah, those are like you said, we also need to look at like, where is this arising from, like in the society? Like, why are people feeling so pushed to even take such huge risks and being able to accept that, I'll do it in the back of a salon, I'll do it in someone's apartment. Like, to come to that decision, what kind of pressures are you facing?
Exactly. It says a lot. If you're from the UK or you're from a very, very different country, you tend to travel all the way to Turkey. They're willing to take all those risks, put all that financial investment. That means it really does mean a lot to you.
There's a pressure.
There's that pressure. And also with recovery, it can take up to 6 months for a surgical fat transplant to fully take effect. As some of it may eventually be reabsorbed by your body during the first months after the procedure.
Read about that.
So now maybe in this COVID pandemic, everyone's working from home, you can almost get away with it. But like, would you be able to afford 6 months of recovery if you had to be going into work every day? Like,
and you're in pain.
Always think about that. Celebrities can afford maybe to, be out to relax for 6 months, but can everyone? I don't know. I don't know.
No.
Yeah, there's a lot to consider.
Okay, so we're gonna go into, before we go into recommendations, now, what do you think governments, politicians, do you think they should be concerned about this? What can they do about an issue like
this? A good question.
I think it starts.
Yeah, go on.
Yeah, I think it starts like with what we're discussing right now. Like, some regulation is needed, I think. Obviously, people can go off to Turkey, and it's not my government's responsible what the Turkey government is doing, but we do need to encourage like people to have at least some international standards or something that we say like, for these, it's a medical procedure, we should at least have some like standards across the world. I think that's to start.
Yeah, and I think the example I mentioned of like in Australia, where the government urges like doctors to assess patients' mental health beforehand, that can help as well, kind of reduce people that are going to take a risk.
Yeah, that would be a very, very great policy guideline. Making sure that everyone has that mental health check before going in. Because, I mean, it's going to be a life change, essentially. So,
yeah, like you're changing your body.
Yeah, you don't want any random surgeon goofing around in your butt.
Yeah, true. It's true.
So on that note, you have, for our fellow Globies, male, female Globies, do you have any piece of advice, solutions, possible recommendations for anyone that is thinking about doing this surgical fat transfer procedure?
I mean, I'm gonna sound like a broken clock because I'm gonna say this every week, but do your research. I'm gonna say this for everything, for every week, please. Yeah, do your research. Don't take, like seek different doctors, like medical advice. Compare, like if you really want to do it, compare surgeons. Choose one that you're comfortable with, but really also look within. Really see, why do you want this, and will you be happy once you get the procedure done? Look at other people's stories, look at how their recovery went, make sure that you've set time for yourself to recover. Please do not go into someone's apartment and get the procedure done. Like, it's not worth it. Don't take a cheap route, especially because with your body and with your life, don't cheap out on it. Like, if you don't have the money, it's not worth it. Like, let's go running, let's do some squats, it's okay.
Exercise.
That is not that important.
Yeah.
It's not, but yeah, that's what I would say.
What about you, Edna? Any burning recommendations?
Yeah, no, I completely agree with everything Loza said. Definitely, like, have you exhausted all options before you start, considering the surgical route? Have you tried doing the squats and the deadlifts? It's hard work, but it can help.
It's better for your health.
It has so many benefits as well. Mentally,
outside of just a big butt,
skin wise, and you get a nice butt, and your health.
It gives you some endorphins. You get stronger.
Exactly. Definitely, yes, do your research, look into who's actually doing your surgery, because keep in mind, the cosmetic surgeons, like, let's say allegedly Dr. Bumbum, it's like they have an interest in obviously charging you and making money out of this, so they may not always give you the whole reality of what this means, which is why it's even more important for you to do your research, know what the side effects are, know what long-term this may mean for you, and like really consider that. Definitely do the self-check. Now, I'm not necessarily saying, governments should be able to police you when they say, no, you are not.
You're not well.
Don't get this BBL, but I think it would be very important for you to be able to do that for yourself. So that would be my advice. Pretty much what Loza said.
Yeah. And I think even more specifically, I'm going to go into that research bit again, just so that our goalies know how to do their research.
Right.
When you're doing that research, double check what training your surgeon has in specific fat grafting techniques. That is very important. And if you're in the United Kingdom, if they're on the GMC, the GMC specialist register, double check that for plastic surgery specifically, not just a general surgeon. And then check how many operations they performed, whether there have been complications with those operations, as well as their own patient satisfaction rates, because obviously word of mouth is amazing. And then if you must get it, avoid fillers and choose your surgeon wisely. If you don't choose wisely, you could end up looking way worse than before, or even die.
Or a leaky butt.
I mean,
a leaky butt. A leaky butt.
I'm trying so hard. Let's give it a try out, making it easy.
If you've had a BBL and it's gone great for you, amazing. We love to see it. As long as your mental state is on check and it's good, that's great. We're not here to discourage anybody that has done it or that wants to do it. All we're saying is understand the pros and cons before you get into something that could potentially destroy or change your whole life.
Yeah. 100%.
Yeah.
Yeah, I think on that note, we can conclude right here.
On that note,
let's conclude. So thank you very much for listening to the World Health Investigation Podcast. I'm Jocelyn.
I'm Edna.
And I'm Loza.
And we are 3 young global health professionals and your hosts of the World Health Investigation Podcast. Thank you and see you next week.
See you next week.
Bye, y'all.